What's up, Sickle Cell Warriors? My name is Dr.O, and today we're here to talk about sickle cell. So who am I? My name is Dr.O, and I'm from Northeastern University. I graduated from Northeastern with a doctorate degree in pharmacy. And I have sickle cell. And the reason why I'm here is because I love to inspire people and I love to be a leader, So even though this is my first time on camera and I'm not really used to this, one of my favorite sayings is champions adjust. So, I'm going to keep doing this and I'm going to keep grinding. But I'm here to inspire you all, I'm here to inspire people with sickle cell and just, people all across the world to just, no matter what you're going through, to just keep on striving. So specifically people with sickle cell, we're here to explain what it is, how to go about dealing with it, and ways to treat the condition. So my story with sickle cell is, when I was younger, I essentially went through so many crises in my life. I had it bad, I had pneumonia, I had acute chest syndrome, and I was constantly going through in and out of crises from, I would say from the age of 8 to 17, 16. So, at nearly every week and every month, I had it bad. I was going through multiple crises, and, every day I would be thinking, oh God, why me? Why me? But I took this drug called hydroxyurea, and that drug essentially saved my life. It pretty much gave me the ability to keep living. Normally, I still had some crises, but ever since I took that drug worked wonders for me. And because of that, I'm eternally grateful for that drug. And so that's why I chose to be a pharmacist, actually, because once I saw the power of what drugs can do for you, I got really interested in hydroxyurea, and I guess that's what made me want to become a pharmacist. So once I started taking hydroxyurea, like I mentioned before, my whole life changed. I used to be super skinny. I probably weighed like 100 pounds. Now today I weigh like 190. I was always in and out of the hospital, and I'm proud to say I haven't been in the hospital for 4 or 5 years. So man, I am super blessed, and I can't thank God enough for what He's done for me. But what I really want to do now is share my knowledge and share how people with sickle cell can actually live how I do and live a lot more healthy. I think because sickle cell is such an under-researched disease, we don't know enough about sickle cell, and a lot of people don't really understand what it necessarily takes for it to be treated. And I have a very unique perspective in which not only am I a doctor, but I also have sickle cell. So I can really explain what is necessary to really optimize your health and just take care of yourself. So hopefully I can provide you guys a lot of useful tips throughout this YouTube channel. I'm not used to always talking about myself. But, if I'm going to start doing this YouTube thing, I'm going to have to get used to doing that. But in all honesty, the reason why I made this sickle cell channel is to inspire people with sickle cell. I know how hard it is to live with it, and quite frankly, having sickle cell is easily one of the hardest things I ever deal with. Not just on a physical level, but on a psychological level. I think that's a very, very, very underrated part about having sickle cell. Nearly almost every day, I'm always thinking about, damn, why do I have this, or how can I overcome this, or how can I really be at peace with this condition? Because it's annoying to have something that you can't necessarily control just affect you every single day. So I know how it feels to have sickle cell. I know how debilitating it could be. So hopefully, just seeing my face and seeing that a young black person who's also a doctor, who's living healthy with sickle cell, I hope that inspires you to watch my channel and get some tips from me. What's my goal with sickle cell? I have a lot of goals, honestly, and I'm not really the type to disclose my goals, but as I do this more and more often, I have to get used to doing that. But one goal I'm confident in telling is I want to be the biggest sickle cell YouTuber in the world, and by getting so much market space in the sickle cell community, I hope that eventually makes me a brand ambassador so that when people think about sickle cell, they can look to me for opportunities to help and market the disease and get some clarity on what we can really do, because I think I have a lot of great insights on how to go about dealing with sickle cell. So that's one of my goals. Another one of my goals is I really want to communicate more with people with sickle cell. I want to know how y'all are also dealing with sickle cell, because quite frankly, having sickle cell is a lonely journey. I don't really know too many people with sickle cell. Don't get me wrong, I do have a couple friends, but it's here and there. So one thing I really want to do is I really want to meet people with sickle cell, and hopefully with the power of the internet and as I get more viewers and subscribers, we can connect more and just really explain what we do like and what we don't like about sickle cell. I also want to just educate myself on sickle cell even more, and so by doing this YouTube channel, it's going to force me to do even more research on sickle cell. I mean, I also have a lot of papers published on sickle cell. I have linked down below in this description so y'all can see that. I also created a bunch of posters, scientific posters, talking about sickle cell and how you can manage the pain. So I've done a lot of work in the sickle cell community, and I even have some published papers, but I still think you can never know too much. So I'm gonna use this channel to educate myself more on sickle cell and teach y'all also about sickle cell. So it's kind of like a two-way process where I'm learning about sickle cell, but you're also learning about sickle cell, and together we grow. So one of my favorite quotes in the world is, "Be the change you want to see in the world." And I'm not really the type of person when I see an issue I complain about it. There's so much I want to see done in the world, and I really want to be a leader in this community. So I'm tired of having people feel the need to not share that they have sickle cell. And if I want to change that, that change is going to start with me. So I'm going to tell the world I have sickle cell so other people can feel more comfortable saying that too. I'm tired of the disease not getting the research and the funding it deserves. People, I don't want to, no disrespect to people with cancer or any other thing, but those diseases tend to get a lot more attention and the funds. And I'm not saying they don't deserve it, but compared to sickle cell, sickle cell is a lot more underfunded, and it should not be like that. And we can go on and on. It's probably because it's a minority disease, but besides the point, I want to be a person who can provide more research for the sickle cell community. I want to be a person who can provide more funding for the sickle cell community. And most importantly, when I was young, I always wanted to know somebody in the sickle cell community who I can reach out to or just simply watch. I've always I never really had anybody who I can talk to about sickle cell. And so by creating this channel, I feel like hopefully you can also learn more about sickle cell through me, through my habits, what I'm going through, and I'm always going to share myself through the ups and downs, no matter what. So even if I'm in the hospital, I'm going to show that, and even when I'm doing well, I will show that. But today is the beginning of greatness. Join me in this journey, and together we will conquer sickle cell. Thank you for blessing me.